In this video, we are going to learn how we can heal others with the help of Reiki energy. The first thing which we need is a room. But what kind of a room do we actually need? We need a room which is clean. We need a room where a person comes in and feels safe. He feels as if he has come to a place where he is under some sort of protection. So you don't need a room where there are a lot of noises coming. So if children are playing somewhere near and there are a lot of noises which are coming, or your room is near the market and there are very traffic cacophonous voices coming, then there would be a problem. In case, to reduce the background noises, you can put on Reiki music. Similarly, you don't want a room where there's a very dark color walls. The color of the walls has to be light, it has to be pastel. Similarly, you have to make sure that the room is clean, it is not dirty, there are no spider webs in the room, etc., at any of the corners especially. So this is something which is basic. After that, you have to make sure that you are not distracted by any other thing while you will be performing Reiki on other people. That means you have to be sure that during the Reiki session, there would be no mobile phone rings, there would be no doorbell rings, etc. If you have a receptionist, then it's okay because she can take care of that. However, if you don't have a receptionist, then you have to make sure that these things do not interrupt you in between. Also, you have to be careful about the room temperature. In case you are in a place which is very cold, you need a warmer over there. In case you are at a place which is very hot, then you need air conditioning. This is how you make the other person be comfortable. So either you'll have a bed which is used by the doctors or acupressurists, or if you don't have that, then you can have either a mattress or a couple of blankets, and you can have them on floor, and then your patient can lie on the floor. But you need two pillows. One pillow to be placed under the head of the patient and the other pillow to be placed under the knee of the patient. And then, of course, you need a little blanket or a sheet so that in case a person feels like, then he or she can have it. Apart from all this, you can have some crystals. If you have knowledge about crystals, then you can place some positive crystals so that you have a nice aura and a nice feel and a nice ambience of the room. For example, amethyst is a very nice crystal. Rose quartz is a very nice crystal. They help in the healing process as well. So once your hands are sensitive enough, you'll also be able to feel the strength of a crystal on your palm. So if I close my eyes and if you keep a amethyst on one of my palms and a normal pebble on the other of my palm, then I'll be easily able to tell you from where the positive energy is emanating. So these kind of crystals not only help in creating a positive aura or a positive ambience in the room, but they also help in the healing process. If you have an aquarium, it's also nice, or you have the voice of a running water somehow, it has a tremendous healing effect. Other thing which you need to have is some Reiki music, because initially what happens is you forget when it is the time from moving from one place to the other place to the other place and to the other place. So the Reiki music will give you a chime. After every 3 minutes there would be tang, and you will recognize that now it is time to move from one position to the other position. But slowly and gradually, as you progress to becoming a better and a better healer and your hands become sensitive, you would automatically come to know where the problem is, where the negativity is, and you'll straight away jump to that particular area and call upon the Reiki energy to heal that area. Similarly, you need a tissue box, because many times people will cry while receiving Reiki healing, and if they cry, then you need to give them some tissues or napkins. So that has to be ready. And another thing which you can have is some incenses or oils. If you know about oils, then you can have some oils, but they don't have to be very pungent, or they don't have to be something of a very hard kind of a smell, because we have to keep everything very subtle. Many of the Reiki healers also do this thing, that they present some of the oils to the clients and just ask them which one do you prefer, and then they use that particular oil while they heal that particular client. This way they make sure that a person is not repelled by those incenses. So broadly, you need all these things. Now, the other thing is that whenever somebody comes, then you have to make sure that you remove the patient's jewelry. So although a healer can wear this, because a healer knows how to make sure that the crystal or the precious stone which you're wearing, it has to be gotten rid of the negative energy from time to time. However, when a patient comes, you just make sure that he removes his watches, he removes his jewelry items, necklaces, chains, earrings, and then he wears clothing in which he or she is relaxed. So if he is wearing very tight clothes, we make sure that he removes the belts, the ties, the shoes, so that these things are not strangulating him. He is at total ease. When we do some kind of meditation camps, then we make sure that every one of our participants has something called as a choga. It is a long kurta, or it is something which is a very loose cloth. It starts from here and extends till the legs, so that let clothes not become an impediment to what we are trying to do. That is the basic purpose behind it. Now, alcohol does interfere with our healing, and therefore there is a standard instruction that you'll have to give to your clients, that they should not take alcohol at least 24 hours before they plan to visit you. Also, although you do care about your personal hygiene, but it is my duty as a teacher to let you be aware that you have to make sure that you have this personal hygiene. So there should be no bad odor coming from you, and if it is, and if you're using a perfume which is having a very strong smell, that might act as an impediment. Again, if there is bad odor coming from the mouth because you've had onions or something like that, which has a lot of odor, that kind of a food, then you should gargle with something called Listerine, or wherever you're living, you should inquire about things with which you can gargle in your country, which take the bad odor away. There are mouth fresheners. There are so many mints which you can keep in your purse, and every time you need it, you can just use it. You should in fact make it a habit to have a lot of mouth fresheners. So this is basically broadly the things which you need to care about while doing a Reiki session for other people. But you have to remember that it is the Reiki energy which is ultimately healing other people. It is not you who are healing. So tomorrow, if you feel, oh, I have healed this guy, then you will develop a lot of ego, and because of this high ego, your connection with intention and with the Reiki energy will loosen, and once this connection is loosened, you will not become a great Reiki healer. This will definitely act as an impediment towards our road to becoming a better and a better and a better Reiki healer. Whenever you start your Reiki session, we start it with a prayer. So whichever God you believe in, you have to call upon that God. Fold your hands in a position like this, right in front of your chest, about 2 to 3 inches away from your chest. Call upon that God, and then call upon the Reiki universal energy to flow throughout your body, and to flow in such a way through your palms that they reach your client and heal him or her of her various ailments. With this prayer, with this mindset, then you start to do your Reiki healing session. And not only do we do this prayer in the beginning, we also do this at the end of the Reiki session. So when the Reiki session is about to end, again, you will show your gratitude from the heart, of course. It is not the words that count. So even if you keep quiet and internally you are doing the prayer, it amounts to the same thing. What matters are your feelings. What doesn't matter is the actual words which you are speaking from the mouth. So again, you will thank all the Reiki energies for helping you to come in the room and to heal your patient. So this is how you do the prayer. But this Reiki session is normally a longer session. It takes about 60 to 90 minutes. So you need to be a patient person if you are a Reiki healer. The first thing which you do when a client is there, after of course you have done the invocation or the prayer, is that you comb or clean the aura. Now, what do we have to do to clean the aura is you have to run your hands in your client's aura, that is about 6 inches away or 4 to 6 inches away from the body, right from the head down till their feet, in a slow, smooth motion, at least 3 times, and then have this kind of energy and throw it off, all the negative energy on the floor. After that, once you start doing and giving Reiki, you just have to place your hands gently over the client's body. Especially, you don't have to touch any area which is burnt. So if there are any burns, just keep your hands 4 inches away or 3 inches away from the client's body. Similarly, you don't have to touch the breasts or the genital areas. You just have to keep the hands a little above them, say about 3 to 4 inches. So we start with the eye. Keep your hands on the eyes of your patient. Then on the second time, you go to the top of the head. Third position, move to the ears. For the ears, you might tell him to turn his or her head on one side and then slowly on the other side while you heal the other ear. Then the fourth position comes on the occipital ridge. For this, you can ask your client to turn the head and then provide healing in the occipital region, or you can just make sure that your hands slide like this beneath his head, and then you can provide healing in this region. Then fifth position is of the jaws and the throat chakra, and then sixth position the shoulders, then the heart chakra and the thymus. The eighth would be the solar plexus, the ninth would be the sacral chakra, and the 10th would be the root chakra, the 11th would be their knees, and the 12th would be their feet. These are broadly the healing positions when a patient is lying with his face above, and then you tell him or her to turn over. Maybe that he's gone into sleep, then you just gently waken him up and then request him to turn over. And once he or she turns over, then the 13th position where you have to provide the healing is the shoulder blade. The 14th is the heart chakra. The 15th, again, we'll cover all the chakras from the back side. 15th would be the Manipur chakra. 16th would be the Swadhisthana chakra. 17th would be the Muladhara chakra. And the Muladhara chakra, you can use the T position of your hand like this. And then 18th is back of the knees, and 19th would be the soles of the feet. Finally, you can take one of your hands. For example, we take the left hand and we put on the crown chakra, and the right hand we put on the base of the spine. And we keep it again, as for the other positions, for about 3 to 5 minutes. And finally, we comb once again the client's aura to get rid of any negativity that he or she might have. This movement has to be firm, it has to be smooth, and it has to be full, right from the crown till the feet. And then you can touch the ground as well with your hands. So I have combed it, and if this is the ground, I have combed it, and so the energies have been now grounded. So this is how a Reiki session would seem like. However, there are certain precautions which you need to take. So if some person has a pacemaker, then Reiki energy might interfere with the energy which is being supplied by the pacemaker. That might cause a problem. So that is one of the things which you need to ask before you decide to provide Reiki healing session to someone. So in that particular case, it is not that you will say no to him or her, that I won't be able to provide you with Reiki healing. All I am saying is that then you will not provide healing to this particular heart area. Similarly, if somebody is suffering from diabetes, then, because Reiki has a proven effect of reducing diabetes, and therefore if the person is like a very proactive person who keeps on testing his sugar level, then it is okay, because then he would alter his medicine as the sugar level would alter with the help of your healing. Otherwise, it is better that you avoid healing people who are suffering from diabetes, or if they agree to check their diabetes from time to time, then it is perfectly fine to provide Reiki healing to them. So some people, they after the Reiki session, you have to have a feedback session with them. You just ask them, how was the session? How are you feeling? Did any memory flashes come to you? Did you sleep? Did you feel any kind of coldness or hotness in your palms or your feet? Because these are certain common reactions which do occur. And once they do, then you have to make sure that your patients are comfortable with those reactions. You have to tell them, yes, this is absolutely normal. So there is nothing wrong which has happened with you. At the end of the session, make sure that you go and wash your hands under running water. And you also make sure that your client also has a sip or two of water. This is how a Reiki session would typically end. However, there would be times when people don't have time for 60 to 90 minutes and they can't go in for a longer Reiki session. They would come to you and they would say that, like, I'm just working over here. So in the break time, I can come to you for 30 minutes. Can you do something to me? Can you give me Reiki healing still? Then your answer is absolutely yes. We will provide you with a rapid Reiki session. Now, what happens in a rapid Reiki session is that we concentrate on only some of the important positions, and we don't give an elaborate session as what I told you a little while ago. So we start again with invocation. After calling upon the Reiki energy to help you to heal your patient, then you let the patient be seated. Go at the back side of the patient, put your hands on the shoulders, call upon the Reiki energy, and then you start the first position by taking your hand on the crown chakra of your client. Then you move towards the side, either from this side or this side, and then take both your palms and put it in the third eye chakra and provide healing here for 3 minutes. Then you move to the throat chakra. Because you're on the side, it is easier for you to do it because the client is seated. And then from the third eye chakra to the throat chakra, to the heart chakra, to the solar plexus chakra, to the sacral chakra. And then you again move in the front and provide healing to the knees. And then you kneel down and provide healing to the feet. And finally, what you do is that you comb the aura and touch the ground so that all the negativity is earthened or it is grounded. Again, as usual, for every Reiki session, you go and wash your hands and make sure that you offer water to your client. This is broadly how we give healing session to others. So the first thing which you have to do is you have to do Reiki healing for yourself. Once you're able to do that, then you have to call some near and dear one. I'll provide you with a detailed video wherein step-by-step guidance would be given how to exactly carry out Reiki healing session on others. So once you call the near and dear ones, you are able to give Reiki to them. Only then should you start your journey to healing other people whom you don't even know. My best wishes are with you.